Great. Thank you, everybody. As I mentioned, thank you for joining. We're excited to um, have this conversation here with everyone in regards to Social Security. Incredibly important topic, of course. Very easy to make mistakes as you go through this process, and it is imperative you hopefully do everything properly the right way. And we got some great information from an expert here today to help in any way that she can. So excited to bring that information to you. Um, my name is Ernest Collins. I work as our financial advisor here at Uncle Credit Union. I'm the vice president of our wealth management department. We specialize in pretty much everything investments, life insurance, annuities. We can do financial plans. We help our clients to the best of our ability make sure they are as fully prepared as possible for retirement and do educated calculations to make sure we don't run out of money and things pass along in the proper way. So any way that we can help with that, please let us know. Our number, that's our uh, overall Uncle number, but I can put my cell phone there at the end and email as well. So you can contact me directly after if you have any questions. And a little bit about my background. I've been an advisor for 12 years. Um, Couple stops at some larger institutions like Bank of America and Citibank, but I've always been a financial advisor. Really enjoyed my time here, though. At It's my fourth year here at Uncle Credit Union. There's certainly a difference in the credit union experience. We want to make sure we take excellent care of everybody, and at other institutions there might be minimums to work with certain advisors, and at Uncle we do our best to make sure we help everybody with no minimum, which is great. So we're really able to do the best we can to help everybody out. Really excited to present Grace Sampson here today. She's going to be our speaker. She's from the Social Security Administration. Throughout her career, she started in 2008 as a claims specialist, and then in 2016 she became an operations supervisor and has gained experience leading staff throughout the busy Bay Area marketplace in their district office. She has served as a mentor and participated in numerous outreach events throughout the community. And we're just really thankful to have her participation here today to get an industry expert for our membership here at Uncle Credit Union. So without further ado, I will turn it over to Grace. And thank you very much for being here, Grace. We're excited to have you.
Thank you so much, Ernie. Good afternoon,
Of
everyone.
course.
Thank you also for being here. My name is Grace. Like he shared, I'm the public affairs specialist for the Bay Area. Bay Area for us includes what all of us that are local here know, but we cover about 27 offices. So going as far east as maybe like Suisun, Fairfield area, up to San Mateo, San Rafael, and then all the way down to Salinas. So pretty big area that we cover. Um, Today, I'm going to talk about Social Security retirement programs as well as spouses benefits, other family benefits available, survivor benefits, and then we'll touch on Medicare. So I'm going to go ahead and share my screen with you. You should be able to see that momentarily. And if I could get a thumbs up, just to confirm that you guys can see it, I'd really appreciate that. Thank you.
Looks good.
Thank
Yep,
you.
looks good.
Thank you, Dree. And Natalia, thank you. All right, perfect. So let me see if I can, wrong screen there, find my screen. So I do start with the disclaimer just to advise everyone here that the material in this presentation has been prepared by the Social Security Administration Public Affairs Office and is intended for educational purposes only. Participation in this presentation doesn't constitute an endorsement by Social Security um, or its employees of the organizations and information and products not covered by Social Security. So I like to go into, um, sorry, this isn't the to the website just so you guys can see what our landing page looks like. Our website has just a ton of information, and since COVID, we've really tried to improve not only the formatting, the organization of things, but really trying to make sure we're including everything that people need or would want to be able to do online. So this is our landing page. I want you to always make sure that you're going to a website that ends in .gov. So you could type in socialsecurity.gov, or you could type in ssa.gov and you should hit this is what you should see. Okay, if it doesn't end in gov, it is not our website. The four tiles there in the center: get a benefit estimate, apply for benefits, check your status, and replace your card are the four most popular tasks or actions that people contact a Social Security office for. So we like to put those right there in the center so that if those are one of the things you need, you can get information on how to go about doing it right away. The search function on the top there is actually really great as well. Just type in any keyword and it will link you to any to information within the website, as well as any articles or blogs having to do with that topic. If you prefer your website to show to you in Spanish, you can click on the Espanol word right there and it'll transition everything and it'll be in Spanish. And if you have your My Social Security account already, you can click and sign into your account. So for those of you that don't yet have your My SSA account, I really encourage you to do so. It's not only convenient, it's secure. It helps you to be in control of your personal information. If you're planning for retirement, if you're looking for information about your own record, maybe you're looking at different estimates, maybe you're already getting benefits and you want to make any updates. You can do all of these things through your My Social Security account. If you created your account before 2021, then that is what we consider a legacy account. So you'd have to update your account and transition to a new account using either login.gov or ID.me. There is a video on our website that helps you to choose maybe which platform would be the best for you, whichever it is, login.gov or ID.me. Login.gov, however, if you do create that one, you could use that on all the other federal websites. Additionally, on our YouTube channel, if you decide which one you prefer, we also have another how-to video on how to create your login.gov or your ID.me account. So this video here is just showing you maybe which one would be better for you to help you make that decision. You can have one of each, so that's fine too. Now with your My SSA account, we list here just all the different things that you can do through your My SSA account. I mentioned for people planning for retirement, it's an excellent tool because it allows you access to our various retirement calculators. You can also check your earnings record to make sure all of your earnings are reflected on your Social Security earnings record. Since this is how your benefits will be calculated, it's important to make sure that all your earnings are there. Like I said, you could also change your address, your phone number, your bank information through your online account. Maybe you want to see your retirement estimate for the various ages. Maybe you want to see if you can get spouse's benefits or survivor benefits, or maybe you just want to replace your Social Security card, replace your Medicare card. All of these things can be done through your My SSA account. Maybe you're not the type of person that likes to have a bunch of things mailed to you and you want to be paperless with your notices. You can elect to do that as well. So a ton of different things. I won't read them all. I do encourage you to create one though if you haven't already. And this is one of the tools that you can create through your My SSA account, which is your Social Security statement. Some of you might be old enough to remember when we used to get these in the mail, and they were like a white and green pamphlet, several pages long, with your earnings on it, with the estimates for retirement at various ages, information about disability benefits, information about survivor benefits, Medicare, etc. Well, we've streamlined that document and it's now just a one-pager, so front and back, just like this. And it's one of the most important tools for planning your retirement. And you can check your earnings record and you can generate this from your My SSA account. You would only get this in the mail if you're 60 or older and do not have a My SSA account. If you aren't able to generate this through your MySSA account, you can contact us and we can mail you one as well. Now, Social Security was never meant to be your only source of income in retirement, but it is understood to be a foundation, one of your sources of income, right? You want to also think about other sources of income that you have, savings, investments, pensions. And I'm sure our friends here at Uncle, and other financial experts will say that you want to have anywhere between 70 to 80% of your pre-retirement income to live comfortably in retirement. So, with Social Security being one of the building blocks for your income in retirement, let's talk a little bit more about how you qualify for retirement benefits. In order to receive Social Security retirement benefits, you have to earn Social Security credits. You need at least 40 credits, which equates to about 10 years of work. For 2026, every $1,890 gross that you earn earns you one credit. You can earn up to 4 credits a year. Now, with these 40 credits, or at least 10 years of work, you entitle yourself to Social Security retirement. You can get your Social Security benefits as early as age 62. You could wait till full retirement age, or you could wait till after full retirement age, delaying your retirement, earning what's called delayed retirement credits for every year that you wait. So at age 62, it's the earliest you can get it. It's also going to decrease your benefit amount. You're going to be reduced. If you wait till your full retirement age, you get your full benefit amount, unreduced for age. Now, if you wait till after your full retirement, you're going to earn about 8% a year up to age 70. So, what's your full retirement age? Some of you may know, some of you may not. But your full retirement age is based on your year of birth. So, you can see in this chart, the years of birth are there in the left column. And directly to the right of that is the full retirement age for that year of birth. So someone born in 1955, their full retirement age is 66 and 2 months. Someone born in 1958, their full retirement age is 66 and 8 months. For anyone born in 1960 or later, their full retirement age is 67. So waiting till that full retirement age allows you to collect your unreduced benefit amount. However, if you take your benefit at age 62, which is the earliest that you can get it, I had mentioned earlier you'll be reduced by age. So you can see in that third column the percentage that your benefits would be reduced by taking it early at age 62. So for someone born in 1960 or later with a full retirement age of 67, if they take their benefits at 62, they're going to be reduced by 30%. Okay, someone born in 1945, their full retirement age is 66, and if they took it at 62, their benefit would have been reduced by 25%. So what does this look like in real time? Here's an example of a person whose full retirement age is 67, and their benefit amount at full retirement age is $2,000. So you can see on the bottom axes there, that's the ages. And then the bars are the monthly benefit amount on that right column, right? So you can see at age 67, slide up, the benefit amount is $2,000. So that's their full retirement age, their full benefit amount. But every year that they get it before 67, you can see that it's a little bit smaller, with the smallest amount being at age 62 at $1,400 a month, right? So every year that you wait, it gets a little bit bigger. However, taking it at 62, you are locking yourself into that $1,400 a month. It's not going to grow anymore. You're not going to turn 67 and all of a sudden you get a boost to $2,000. That's not how it goes. You're locked into that 1,400. That's going to be your ongoing amount for the duration of the time you're getting benefits. Now, it might be small increases for recalculations if you can continue to work, or with cost of living increase, but pretty much you'd have that same amount. So it's lower, right? It's about $600 lower, but you're getting it for longer. So you're getting it for age 62, 63, 64, 65. You're getting it for 5 additional years at that lower amount. So if you're thinking about what's the break-even point, there is a break-even calculator available through your MySSA account. So you can see how long do I have to collect my $2,000 at 67 to make up what I didn't collect at 62, right? This is the number one question that we would get as retirement claim specialists. It's like, well, when should I get it? What's the best age? And really, it's not a one size fits all type of answer. We can give you the benefit amounts at the various ages, which is a great tool to help you decide. But this doesn't include any other income you may have. If you want to continue to work, if you are working, your family history, your current health situation, all of these other things are other factors that play into when you want to start retirement. Like I mentioned earlier, through your My Social Security account, you can use the various retirement calculators, break-even point calculators, etc. Now, how do we determine your benefit amount? Well, your Social Security benefit amount is based on your earnings. So the first step is we take your wages and we adjust them for changes in wage levels over time. Simply put, we account for inflation, understanding that $100 worth in 1995 is not the same worth of $100 in 2025, right? The second step is we find the monthly average of your highest 35 out of 40 years of work. Monthly average of your highest 35 out of 40 years of work. Not high 3, not high 5, not all of them, but highest 35. If you have not worked 35 years, then we will use all of your earnings to find that monthly average of those. And now that figure is your average indexed monthly earnings. And it's with that figure that we apply the calculation for retirement benefits. And here is the formula. With this example, this person's average monthly earnings are $8,000 a month. That means that their monthly benefit amount would be $3,263. This is not reduced for age. This is at their full retirement age. So the calculation is we take 90% of the first $1,286, excuse me, and we add that to 32% of earnings between $1,286 and $7,749. And then we take 15% of any earnings over $7,749, if there are any, and we add that amount. So adding the three amounts using this three-tiered calculation gives us $3,263 a month. Well, maybe your average monthly earnings aren't that high. We have another example here of someone with an average monthly earnings of $4,000 a month. And you can see applying the same calculation where it's 90% of the first $1,286 plus 32% of any earnings between $1,286 and $7,749. And because there's no earnings over $7,749, that figure is zero. But we add these two together, giving us $2,025 a month. Another popular question that we receive is if you can work and collect your Social Security. And the answer is yes. However, there are earnings limits. So if you are under your full retirement age, and that's what FRA means, is full retirement age. If you are under FRA, the limit for earnings is $24,480 a month. A year. I'm sorry. $2,400, $24,480 per year. And we're looking at gross. So if you earn over that, we will withhold $1 for every $2 you earn over the limit from your Social Security checks. In the year that you turn your full retirement age, this annual limit increases to $65,160. Again, this is gross, and this is for 2026. If you are over that $65,000, we will withhold $1 for every $3 you earn over the limit. Now, if you wait until full retirement age, there is no limit, which is another reason that people do like to wait till full retirement age to take their Social Security retirement. Now, when you're ready to file for benefits, you can do so by filing for your retirement online at our website. You can also contact us and schedule an appointment. You can either call our 800 number to schedule your appointment, or you can visit an office that can make an appointment for you. Now, when you do go to your appointment, or if you're going to do it yourself online, you do want to have some information handy, like your dates of marriage if you've been married before. Most importantly, your direct deposit information. You're going to have to enter that routing number and account number. Now, once you file for your retirement, there are additional people that can collect benefits on your record. And we call these like family benefits. Okay, so if you have any children that are under 18 or under age 19 still enrolled in full-time high school that are not married, they can collect your from your Social Security as an auxiliary child. If you have a disabled adult child that was found disabled prior to age 22 who is unmarried, they can also collect from your record. And then, of course, your spouse. Your spouse has to be at least 62 to collect from your record, or they can be at any age if they're caring for a child under age 16 or a disabled child. And we call those mothers or fathers benefits. Now, spouses can collect from your record once they hit 62, but you have to already be collecting. Okay, they can't jump on your record unless you're already getting it. Additionally, their maximum benefit is 50% of yours, of your unreduced amount. So whatever your amount would be at full retirement age, they can get up to 50% of that if their benefit amount is lower than yours by 50%. So basically, spouses benefits were created when American households typically had a one-income household. It's not the same so much anymore. For some people, it is. So in order to be able to be entitled to get spouses benefits, your benefit amount has to be less than 50% of your spouse's in order to collect anything additional. For example, if my Social Security retirement is $1,000, for me to be able to collect from my spouse's, his benefit amount has to be over $2,000. And if it is, then I could get maybe additional income from my spouse, because I have to get my own before I can collect spouse's benefits. But mine has to be less than half of my spouse's. Now, if your children or your spouse jump on your record, it does not reduce your benefit amount. Period. You're the worker, your benefit is not reduced. Now, divorced spouses can also collect from your record. They have to be unmarried unless they get married after 60. They have to at least be 62 as well. They have to have been married to you for at least 10 years. They do not have to wait for you to file, but they do have to wait for you to attain age 62. Again, if a divorced spouse jumps on your record, it does not affect your benefit amount. Now, if you were to pass away, the same people are entitled to survivor benefits. Any children that are 18 or 19 still enrolled in full-time high school, okay, full-time high school. We don't pay any higher than 12th grade. We don't pay kids in college. It's just full-time high school. No older than 19. So they'd have to have a late birthday at that point. They have to also be unmarried. Again, with the disabled adult child, they have to have been found disabled prior to age 22 and be unmarried, and they could also collect survivor benefits. Now, your surviving spouse is eligible for survivor benefits as early as age 60. If they collect as early as age 60, that's the full reduction. They'll get 71.5% of your benefit amount. If they wait till full retirement age to collect their survivor benefits, they will get 100% of your benefit amount. There is another program called Disabled Widow or Disabled Widowers Benefits that you can get as early as age 50. Okay, this is a bit of a different application process. It's a survivor claim, but it's also a disability claim. So they have to be found disabled by Social Security. And then, of course, there is still the mothers or fathers benefits for a spouse any age who is also meeting the earnings requirements, but also has a child under 16 or a disabled child. And there's also the lump sum death benefit, which is $255 payable one time to the surviving spouse. If there is no surviving spouse, it would go to any minor children. Now, your benefits can be taxable. Social Security representatives are not tax professionals, so they won't be able to really answer any tax questions for you. Um, we do send you a 1099 every year if you're on benefits that you can use for tax purposes. If you need a replacement 1099, we can provide that for you. If you want to elect to get federal taxes withheld from your check, you can do so as well when you file for your retirement or at any time after you've started collecting it. Now we're going to talk a little bit about Medicare. Medicare is our nation's health insurance for people that are either 65 or older, have been on Social Security disability for at least 2 years, or are suffering from ALS or kidney failure. If you are on disability, have ALS or kidney failure, you could be entitled to Medicare earlier than age 65. But for most people, Medicare eligibility begins at age 65. And there is 4 parts. There's Part A, which is hospital insurance. This is hospital insurance. If you're ever hospitalized, have any overnight stays or inpatient stays over long-term care facilities. There is no monthly premium for Part A. You've already paid for it with the Medicare taxes. Now, Part B is what we more traditionally think of as health insurance. These are your doctor visits, your exams, your tests, your outpatient services. And then Part C is a bundling option. Okay, and I say option because you don't need a Part C. However, a lot of people do choose to have a Part C. A Part C, like I said, is an Advantage plan, a Medicare Advantage plan, or maybe called a Senior Advantage plan, and it bundles the A and the B and the D. Part C also allows for things like vision, dental, hearing, which traditional Medicare Part A and B do not cover. Part Cs can also help with out-of-pocket expenses. And then there's Part D, which is your prescription drug coverage. So you could have an A, a B, and a D if you wanted to. You don't need a supplement. But if you feel like you want your out-of-pocket expenses to be lower, you might need things like hearing, dental, or vision, then it's important to look into a Part C. And these will be all the different mailers that you're going to get as you start approaching age 65, or emails that you get. All of these different companies and organizations that want to be your Part C. Now, there's 3 enrollment periods for Medicare. The first enrollment period is called your initial enrollment period, and this is a 7-month window surrounding your birthday. It begins 3 months before your birthday month. It includes your month of your birth where you turn 65, and then the 3 months after your birthday month. So that 7-month window to enroll in Medicare. However, let's say you're working and you have health insurance through your employer, or your spouse is working and you're covered under a group health plan. You can delay enrollment into Medicare after 65 under what's called a special enrollment period, which is that box there on the bottom right. You qualify for a special enrollment period if you're over 65 and you're covered through a group health plan from work, either your work or your spouse's work. Then you can delay enrollment. The special enrollment period is 8 months after your last day of work or last day of coverage to enroll in Medicare Part B. So when I say that you have to be covered through a group health plan through your work, it means that either you or your spouse are actively working. It's not health insurance through COBRA. It is not health insurance through a retirement plan. It is one of us are actively working and we're getting health insurance through our job. If that's the case, you can delay your enrollment into Medicare with no penalty. If you enroll late for Medicare, every year that you're late, you pay a 10% increase in your monthly premium, and that's a lifetime penalty. So if you're 1 year late, it's a 10% increase. If you're 2 years late, it's a 20% increase. And these penalties are permanent. And that's why it's very important that you enroll on time. And that's why you'll hear a lot of your friends, colleagues, coworkers talk about, hey, don't be late for Medicare, because that penalty does exist. Now, there is also a general enrollment period every year between January 1st and March 31st. For most people, Medicare Part B premium, they'll pay the standard premium, which for 2026 is $202.90. However, if you have a higher income, you and your spouse have a higher income, you may have to pay more for your Medicare Part B and Part D premiums. On this chart, you can see the different thresholds of income that will indicate how much additional you would have to pay for Medicare. This is called an IRMA, Income Related Monthly Adjustment Amount. The look back period is 2 years. So if you are in 2026 to determine whether or not you have to pay an IRMA, we would look at your income from 2024. And we are looking at your modified adjusted gross income. So in 2027, the look back period would be 2025. So we'd be looking at your modified adjusted gross income from 2025. If you are subject to paying this IRMA, you would get a notice in the mail, and the notice would give you different options. And one of them, towards the end of the notice, will say if you had a life changing event and your income is no longer this amount, or the spike of income was due to that life changing event, then you can complete a form and won't have to pay for the additional premiums. Okay, so if you get a notice like that, you want to make sure to read through it thoroughly and take appropriate action based on what your situation is. Now, Medicare is its own entity. Okay, it's called Center for Medicare and Medicaid Services. They're their own federal agency. So this is their website, medicare.gov, and their 800 number. Likewise, on their website, you can create a Medicare account. We also have a resource here listed on this slide for what's called in our area HICAP, which is a health insurance advocacy program. It is mixed with a lot of volunteers that study Medicare policy and procedure. And if you have questions or you need assistance regarding Medicare, they are a free service. You would call this phone number and enter your zip code, and they would route you to the HICAP of your county. And they would help you. I mean, it doesn't even have to be like a problem or a complaint or anything. It could also be maybe you just need help on finding the right Part C based on your health, conditions, based on your medications. They can help you do that. One that you find is more affordable than maybe the one you have now, something like that. They can help with anything really Medicare related. Now, because Medicare is their own entity, a lot of times people get confused about who do I contact? Do I contact Medicare? Do I contact Social Security? Well, Social Security handles the application process, the enrolling, and then the billing. So if your questions have to do about those things, you would want to contact Social Security. But if your questions have to do about coverage, maybe you're looking to buy durable equipment or something, these are Medicare questions. Things having to do with the insurance aspect would be a Medicare question. When you call our 800 number, you can opt to use the automated phone service. This is a newer enhancement to our 800 number that we didn't have last year. I think it rolled out in late fall of last year. So if you want to do a simple task like requesting a benefit verification, maybe you need a replacement 1099, you want to check the status, change your address, get a replacement Medicare card, you can opt to use the automated phone service, which is available 24/7. So that includes weekends and holidays. It's been helping to complete about 20% of our calls. And that way you don't even have to wait to speak with an agent. You could use this automated phone service. If you don't, you do speak with a live agent. I've had that question come up a lot. Hey, do I get like a live person or do I get like an automated person? No, you get a live person when you call our 800 number. I do also want to mention scams just because, there has been an increase in the amount of scams and fraud, and you get them by telephone calls, you get them by emails, sometimes you get text messages, and they are pretending to be government employees or government agents, either from Social Security, from the FBI, from OIG. And they threaten and demand immediate payment. They say that either your Social Security number is going to be suspended or you could get arrested. These are all scams. So we just want to remind you not to provide any information. Do not give them any personal information. Do not give them any money. Hang up. And if you can report the scam at oig.ssa.gov, which you can also look for phone number and address is also available where you can kind of give a summary of what happened so that they can continue to build their cases against all of these scammers and see if we could try to find the different fraudsters out here trying to commit these crimes. There's also been a lot of talk about Social Security benefits in the future, especially right now in the news. As of our latest actuary report, Social Security is fully funded through 2034. So in the past, the trust funds have reached the brink of exhaustion, but Congress has always made and pivoted and made changes to avoid this. Um, so even if so we're basically hoping they do the same thing, right? But if they don't, if no changes are made before 2034, then the trust funds will have the ability to pay 83% of each benefit due. So they would still get a check, just would be reduced. So hopefully we'll see something soon of Congress's solution, because although this has been, a topic in the past, I think now that it's 2026, it's becoming a bit more of a concern, right? Because 2034 is right around the corner. Now, we are on several social media platforms that you see here. Our handle is listed right there on the bottom at Social Security. I think out of all of them, if you do have chance to peruse our websites, I would say to go to the YouTube channel and type in our handle at Social Security so you can go to our actual channel. There is a ton of videos, very informative videos. About benefits, about all the different programs we have, which could be retirement, survivor benefits, disability benefits, SSI benefits. There's also how-to videos like how to make your account, information about fraud, information about scams, information about how we keep your information safe, etc. When I was a supervisor in the office, I didn't know of all the videos that were available on our YouTube channel through our communications department. So I wish I would have known so that I could share that with the public as they come in. So if you do have time to pick one of them, I would suggest taking a look at that. I know that was a lot of information, but we're now ready for questions. If you guys have any questions, I believe that Ernie will help proctor this part of the presentation.
Yes, of course. Thank you so much, Grace. That was a great presentation. Touched on really just about everything from beginning to end. And if you do have additional questions, please go ahead and put those in the chat there. We're going to start with some of the questions that were submitted from the enrollment or the sign up form. There was an area to put questions in. So we're going to start there. There's just a couple. It looks like we have plenty of time to hopefully take care of all these questions. But we'll start there and then we'll get to the chat that's here on the Zoom and hopefully, like I said, cover everything. So the first three questions were in regard to spouse benefits and survivor benefits, which I believe you already touched on. So I think unless there's a more specific situation that those individuals would like to put in the chat, I think we're probably good there so in my opinion, I think you covered those already. The next question was about what is the best way to file? Is there a preference, or what are the pros and cons to file online or in person at the Social Security office?
It's really a personal choice. Let me just make sure. Yeah, I'm not on mute. It's really a personal choice. So the agency is really striving to be able to meet, the public in the best service option that they want. So if you feel comfortable doing things on the internet, then Yes, filing online is the best option because you can finish it yourself in about 30 minutes or less. You can submit it and then we get it the very next day. So you're kind of cutting out the middleman of someone, going through it. And it's sitting kind of, I don't want to say sitting on someone's desk because it's not
Hmm.
physically sitting on someone's desk, but um, that's the best way. But if you're the type of person that does want to have a conversation, that does have other questions, that does want that, human touch, then you are definitely able to make an appointment through our 800 number and request that you want to go in person. Or you could just do a phone appointment and one of our agents will call you. Again, these are live people. These are not, automated phone calls. So it's really up to
Yeah,
you.
perfect. Both sound like good options, and you can use the phone. It sounds like as well if you're filing online if you do need a little bit more assistance with questions. So sounds like both both work just fine. The next question was about timing, I suppose. So how far in advance should they file, and how long does it take, I guess, to receive funds once you do file? Um,
Yeah,
you know,
these are great
yeah.
questions. You can file up to 3 months in advance. You do not have to, but some people, especially people that are planner type of people, they can file up to 3 months in advance. No earlier than that. You could file in the month of, and we would still you still wouldn't lose any benefits. Processing time is usually about 30 days if we have all the information that we need. If we're still going back and forth and other documents, maybe you have like a name discrepancy, maybe your name spelled wrong or something like that, then that might add to the time frame. Depending on your month of entitlement, we pay in the rears, which means we pay 1 month behind. So if your month of entitlement is July, you get your July check in August. So as far as when you would get the payment, that would be how it works out. And we pay on Wednesdays based on your date of birth. So it could be the first Wednesday of the month, the second Wednesday of the month, etc.
Good. Okay, great. Thank you for that. This question came with a part two as well. So it says, I will be working at full retirement age and still working with a creditable employer provided medical insurance when I start receiving my Social Security benefits. How do I avoid
Mhm.
having Medicare premiums deducted from my Social Security benefits before I depart my employer and the creditable medical insurance?
Great question. So what I think that was asked is that they're going to be getting Social Security retirement benefits already, but they're going to be working, so they don't need Medicare.
Hmm.
Hopefully, that's what you see too,
I
Ernie.
think
So
so. Yeah, just
you would,
avoiding paying for
if
it
you're,
before they
yeah, if
stop
you're
working. Yeah.
getting Social Security retirement and you're not yet 65, you are automatically enrolled. Okay, so to avoid paying it, when you get the Medicare and the card in the mail, there is going to be on that same paper where you would push out that paper Medicare card, it'll say, I do not want Medicare, sign here and mail it back. That's if you're
Okay.
already getting benefits prior to 65. So I think our question, the person said they're a full retirement age and still working. So they haven't filed yet, but they are going to. Then in their retirement application interview, or if they do it on their own, you would say, no, I don't want Medicare at this time. And it'll have an option like I'm working or something like that. Or you would tell the technician if you did it with someone.
Perfect. I think that answered the question, but I do see that person is here with us. So if that did
Mhm.
not answer the question, please feel free to ask a follow-up question to make sure we get your question answered. All right, so let's move on to some of the ones here in the chat. The first one is, I created my account before 2021, so will I be denied login, or will it ask me to create a new account when logging into the Social Security website?
It's not going to recognize your credentials. So your username and password, it won't recognize it anymore. There's a Here I go plug in the YouTube channel again. There's actually a video about legacy accounts and transitioning to a new account. So yes, unfortunately, you will have to make a new account, but it is going to be more secure than your original account because now we have to be with these third-party platforms. And it is going to be a little bit harder. I think with the first time you just answered a few security questions. Now you know you're going to take a photo of yourself. It's going to ask you different security questions, just similar to like, credit information, but you will have to like take a photo of yourself, a photo of your ID, so give yourself some time, to do it.
Great. Next question is, did you say that if you work until age 66, then you can enroll in Medicare until age 66 and 8 months with no penalty?
I don't think I think that's kind of a mix of the different things
Couple
that I
different things
said.
there, yeah.
So yeah, full retirement age could be 66 or in several months, or it could be 67, but that's when you could get your Social Security retirement without it being reduced, and you could continue to work full time. So that full retirement age is really about the benefit amount and your ability to work. Now, as far as penalties for Medicare, you want to enroll timely, whether that be within that 7 month window of your 65th birthday or within 8 months of your last day of work or health coverage if you're covered through an employer. Okay, that's how you would avoid the Medicare penalty, is by enrolling on Medicare and on time. So it'd be based on your situation. So if you're not working and you're not covered through health insurance when if you're not working at 65 or you don't have a spouse who's working at 65, you want to enroll at Medicare at 65. If you're working or have a spouse working at 65, then you could delay it.
What's the process on delaying it if someone might have that question? Is it the same as you
You
said
just
earlier
don't
where
file.
you just
Well, yeah,
don't file? Okay.
you just wouldn't file
But you
yet. And
won't
then
have the penalty by not filing?
no, you would only get the penalty once you file. But if you're delaying it because you're covered through health, through a group health plan through work, you don't have to do anything preemptively. You would just have to do it on the back end when you're ready to file. There's a form that you would give to your HR. It's a Social Security form that will show that you have coverage, that you had coverage through that after 65 to whenever you decide to get it.
Got it. Okay, hopefully that question was clear for that individual. The next question is, are we able to get that is more for me, I suppose. Are we able to get a copy of this presentation? I think, Grace, because things change so frequently with Social Security and different legislation, they don't offer the slides out. But you have my information, and if there are updates, you do prefer to just kind of access things as they are available to make sure you have the most recent information. So you don't want to look back on these slides. We will have the recording available, I
Correct.
believe, for the
Thanks,
next
Ernie.
couple
And
weeks.
I'll send you something.
Great. That sounds awesome. Yeah, we will
Yeah, and
have
I can
the
send you a
recording of this.
link or a document with some links.
Perfect. That would be awesome. Thank you so much, Grace. And just to answer your question, we will have the recording available for the next couple weeks, and then it will go away because of what I said earlier, where things can change and we don't want to have old information out for people that weren't here and are accessing it for the first time. So it's always good to access that information from the website when you need it to make sure it's up to date. Okay, this question's a little bit longer, so bear with me here. So former employer provides health insurance for early retirement. Former employer is on fiscal year. There was a gap from when I applied for Medicare age 65 and made the change to this one's pretty long. So it might be one where maybe I'll send it to you via email, Grace.
Okay.
And if this individual would like to email me, because it just says iPhone, but if you'd like to email me, I'll keep a copy of this question and make sure I get it sent to Grace and she can answer it because it looks like there's quite a few parts to it. And it's very specific. So I think that would probably be the best way to handle that one, and we'll get the answer to that question. So I'm going to save it and I'll email it to you. And thank you very much for the question, Mr. iPhone. And if you can email me, I will be glad to get you that answer because I don't see your name on there. Okay, and then the next few, let's get the last few answered here. So is the automated phone number referenced this number, 800-772-1213?
Yes.
Great. And then the second part to that is if you are 65 but are working on company health insurance, do you sign up for Medicare A only and then wait to do Part B after retiring?
Yes, you can. You can do that. And then that Part A would just kind of be like a secondary insurance to what you have through your work if you were ever hospitalized. I would double check maybe with your employer because I have heard feedback from the public saying that it might have affected their HSA accounts or something like that. So just want to make sure that that's not a situation that you would have to deal with by having that Part A.
1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1. 1 Next question is, what could be the timeline? Can we expect the recording? So I think that's one's for me too. So we're going to try and hopefully get this out in the next few days, I would imagine. We want to kind of have our marketing team clean it up a little bit because there'll be some time in the beginning where we hadn't started yet, but should be pretty quickly here in the next few days. And then it will be up, like I said, for a couple weeks. So you can access it that way, but we're not going to send out copies of the slides. The last one is I reach full retirement age in November 2026. Social Security projects one benefit at full retirement age and a higher benefit amount starting in 2027. If I start receiving retirement benefits at my full retirement age, will I automatically receive the higher amount in 2027? I think I know the answer to that one, but I'll let you take that one, Grace, if you'd like to.
Yeah, the answer would be no. You would have to wait till the next year to collect it. And that's what we were talked about earlier with the delayed retirement credits, where you earn 8% for every year that you wait.
Right. That amount is set once you pick it, which year you choose. But it does get the inflation adjustment a little bit, right? It won't be the amount you see on your statement there, as she's alluding to, but you do get a little bit of an inflation adjustment, right, Grace?
Correct. If we get a cost of living increase from Congress, then you guys get that. And like I said, if there is, we do these recomputations in the background that are done, automatically. If you have any new earnings, those could affect it, but it's going to go up by a few dollars. It won't be this tremendous jump, right, Ernie? Yeah.
Right. Perfect. Last few here, I think we can sneak in. So this one sounds like it's for me too. So when Grace sends you the documents with the links, can you email it to all of us? Yes, of course I will. I do have a list of everybody's email that signed up for the event, and I will make sure I get that out to everybody as well. And then the last one here, if I apply for benefits under my ex-husband, would he be notified on his benefit?
So he's not going to be notified in the sense that we're alerting him of your information or that it's you that's filing, but he can be accessed the information that someone is collecting. He won't know who specifically it is. And it doesn't affect their benefit amount. So and remember, the door swings both ways. So if you're the higher earner, then they could get it on you.
Right. Perfect. Well, I think that does it. That handles all the questions. For the individual that was asking questions with no name, please, I have everybody's name, but I don't know who is under that. So if you want to put your name in the chat, just your first name or last name, I should be able to find it, or send me an email directly. I'd be happy to get an answer to that question that you offered. That was a little bit longer. But thank you very much, everybody, for attending. Hopefully it was great information. So we got some good feedback. Thank you very much, Grace, for your partnership
Yeah.
on this.
You guys are very welcome. Thank you guys as well. And thank you to all the attendees that are saying thank you. Thank you guys for the feedback. I appreciate it. I did change the slide. I'm not sure if you noticed, just as a reminder that the information is current at the time of presentation, but Social Security policy, it's legislature based, so it's subject to change. So like Ernie said earlier, visit our website for the most up-to-date information. So thank you guys again, and thank you for having me.
Absolutely. And, as you go through this process, Social Security is just a piece of retirement planning. If there's anything we can do here on the Uncle Wealth Management side to help develop a financial plan for you, to supplement Social Security with other areas of 401ks, IRAs, inheritance planning, all of those different things, we would love to help you out and appreciate the opportunity to earn your business.